Today's lectures we'll be looking to what we call health and social care provision. Health and social care provision under the Ascentis-Nursing program. Today we would have to look into understanding the rules of health and social care practitioners. Understanding the rules of health and social care practitioners. Okay. Okay, so we'll look at health and social care provision LO1. Let me ensure that we have something in here and it's going to go LO1. Okay. So we have to look into obviously there are some key terminologies that we have to look into. What is epidemiology? And then what are its benefits? What are the things that we have to look into? So epidemiology is the study of how diseases spread and affect populations. We focus on identifying patterns, causes, and the risks of factors. It involves the collection, analysis, interpretation of data related to the occurrence and distribution of health and disease in human populations. Epidemiologists use various methods to investigate the factors that contribute to the occurrences and spread of diseases, including observational studies, randoms, controlled trials, and systematic reviews. There are also statistical methods to analyze data and to evaluate the effectiveness of public health interventions aimed at preventing or controlling the spread of diseases. Very important. And what then is mortality? Mortality refers to the number of deaths in a given population during a specific time period. Mortality is often expressed as a rate, which is the number of deaths in a population divided by the total population. Mortality rates are used to measure the severity of a disease or population, or to compare the death rates between different populations or time periods. Mortality can be broken down by age, sex, and other factors, which can help to identify patterns and risk factors associated with different causes of death. Okay, then we also need to look at what we call the infant mortality. Whilst we have the general mortality related to death, what then is infant mortality? That relates to death of babies the first year of life. Infant mortality is usually expressed as a rate, which is the number of deaths of infants under 1 year of age per 1,000 live births. Okay, infant mortality is an important indicator of the health and well-being of a population, as it is closely linked to the quality of maternal and child health care, social and economic conditions, and environmental factors. The leading causes of infant mortality worldwide includes complications related to prematurity and low birth weights, birth defects, infections, and sudden infant death syndrome, CIDS. Okay, very important. Then we have to look into reducing infant mortality is a priority for public health programs and policies, as it is a key measure of the overall health of a population and the effectiveness of healthcare interventions and policies aimed at improving maternal and childbirth. Okay, very important. Maternal and childbirth. Then we have to look to what we call morbidity rates. So we looked at mortality, infant mortality, and what we call the morbidity rate. Morbidity rate refers to the prevalence or the incidence of illness or disease in a population. Morbidity is often measured as the number of cases of a particular disease or condition per unit of population, usually expressed as a rate or a percentage. The morbidity rate is an important indicator of the health status of a population and is used to track the burden of disease over time, identify trends and patterns, and evaluate the impact of public health interventions aimed at preventing or controlling the spread of diseases. Okay. Morbidity rates can be calculated for a specific disease or conditions, age groups, gender, or characteristics of a population. The factors, therefore, that contribute to mobility include genetic, environmental, behavioral, and social determinants of health. Public health programs and policies aimed at reducing the morbidity rate often focus on preventing, early detection, and treatment of diseases and conditions, as well as promoting health behaviors and addressing the social determinants of health. Very important. Mobility rate, morbidity rate. Then we have to look at what we call demographics. Demographics refer to the study of the characteristics of human populations, including their size, age structure, distribution, and composition. Demographics is an important field of study in many areas, including economics, sociology, and public health. Demographic data can provide insights into trends and patterns in a population growth and change, and can be used to identify the needs and priorities of different population groups. Some examples of demographic data include age distribution, gender distribution, ethnicity and race, geographic distribution, and socioeconomic status, where socioeconomic status refers to the distribution of individuals across different socioeconomic groups. It is important, therefore, for understanding the disparities in health and social outcomes related to factors such as income, education, and employment. Okay, then let's look at the ethnicity and race. This refers to the distribution of individuals across different ethnic and racial groups. It is important for understanding the disparities in health and social outcomes that may be related to factors such as discrimination or structural inequalities. Okay? Discriminating or structural inequalities. Then we have to look into what we call geographic distribution. Geographic distribution refers to the distribution of individuals across different geographic regions. It is important for understanding the difference in health and social outcomes between urban and rural areas or between different regions of a country. This is what we call geography. Then we have to look into birth and death rate, as well as data relating to mental health and mental capacity, are important indicators of health and well-being of the population, particularly in the context of social care. Some examples of social care related data include birth and death rates. Birth and death rates. While these measures are used to track the number of birth and death in a population and monitor the changes over time, birth rates are important indicators of the demand for social care services such as child welfare and family support. Death rates are used to monitor the impact of diseases and conditions on the health of the population, and particularly in the older age groups. Okay, the older age groups. Then we have mental health. Mental health data relating to mental health includes the prevalence and incidence of mental health conditions such as depression, anxiety, and substance abuse. These data are used to monitor the burden of mental health conditions on the population and to identify trends and patterns in the prevalence and incidence of these conditions. Mental health data can also be used to evaluate the effectiveness of interventions aimed at preventing and treating mental health conditions. Mental capacity. Data relating to mental capacity includes information on the number of people who lack mental capacity, as well as the prevalence and incidence of conditions that can affect mental capacity, such as dementia. This information is important for planning and delivering social care services, particularly for vulnerable population who may require additional support and protections. Okay, this is what we need to take key note of. Mental health and mental capacity. Okay, mental health includes prevalence and incidence of mental conditions such as depression, whilst mental capacity deals with people who lack a mental sense to make decisions on their own. Okay, all right. We have to look into what we call the ASCOP, Adult Social Care Outcomes Framework. ASCOP. ASCOP is a set of indicators used to measure and monitor the quality and effectiveness of adult social care services in England. ASCOP was first introduced in 2011 by the Department of Health and Social Care, DHSC, as a way to provide a clear and consistent way of measuring and reporting the performance of adult social care services. ASCOP includes a range of measures that cover key aspects of adult social care, including the quality of life of people who use services, their safety, the effectiveness of care and support, and the experience of care. Okay, it includes range of measures that covers key aspects of adult social care, including the quality of life of people who use services, their safety, their effectiveness of care and support, and the experience of care. Okay. Okay. Well, measures are organized into four domains. One, we have enhancing quality of life. Two, we have delaying and reducing the need for care and support. Three, ensuring people have a positive experience of care and support. Four, safeguarding adults whose circumstances make them vulnerable and protecting them from avoidable harm. Okay. Each domain includes a number of indicators that are used to measure the performance of adult social care service. For example, enhancing quality of life. Domain includes indicators such as the percentage of people who feel that they have control of their daily life and the percentage of people who feel that they are treated with dignity and respect. Okay. All right. ASFOC is used by local authorities or the councils and other organizations that commission or provide adult social care services to monitor and improve the quality of their services. It is also used by the DHSC to report on the performance of adult social care services nationally. ASFOC then is reviewed and updated regularly to ensure that it is remains relevant and reflects changes in policy and practice. Policy and practice. Okay, so now we have a video to watch. I'll share the link. Share the link. Okay. So about this video, then we can continue. For having done this, we have to go back. Let's finish watching the video. But we have to go back. We have to discuss the importance of data in health and social care planning. Whilst data is crucial in health and social care planning because it helps to inform decisions about how to allocate resources, design interventions, and measure the effectiveness of services. Here are some of the reasons why data is important in health and social care planning. 1. Identifying health and social care needs. Data can be used to identify the health and social care needs of a population, such as the prevalence of specific diseases or conditions, or the level of need for particular services. Okay, 2, we have to look into monitoring and evaluation performance. Is very, very key. Data can be used to measure the effectiveness of health and social care services and to identify areas for improvement. This information can be used to inform decisions about how to allocate resources and design interventions. Okay, very important. Why data becomes an important tool in our daily life or within the health and social care. Okay, why it's very, very important. Okay, very, very important. Okay. All right, so let's look into planning and resource allocation. Data can be used to inform decisions about how to allocate resources and plan for future service provision. For example, data on the aging population can be used. Data on the aging population can be used to inform decisions about how to plan for long-term care services. Okay, and supporting research and development. Data can be used to support research and development in health and social care, such as identifying trends and patterns in disease prevalence or testing the effectiveness of new interventions. Okay, supporting research and development. So why does data play a major role in that? Because you can use them to support research and development in health and social, such as identifying the trends and patterns, disease prevalence, or testing the effectiveness of new interventions. Very important by the use of data. Okay. Or it also supports policy development. Data can be used to inform policy development in health and social care, such as identifying areas of need and designing interventions to address those needs. Okay. Then we have to be able to explain the influence of demographic on service planning and delivery. Demographic refers to the study of characteristics of human populations, including the size, age structure, distribution, and composition. Demography has a significant influence on service planning and delivery in health and social care, as it can help to identify the needs and priorities of different population groups. Here are some of ways which demographic can influence service planning and delivery. Age structure. The age structure of a population can have a significant impact on the demand for health and social care services. For example, an aging population may require some long-term care services, while a younger population may require more preventive services. Okay. All right. So that is very key. Demographic distribution. The demographic distribution of a population can influence the accessibility and availability of health and social care services. For example, populations in rural areas may have limited access to health care services, while population in urban areas may have more access to specialized services. Ethnicity and culture. The cultural and linguistic needs of different ethnic and cultural groups can influence the delivery of health and social care services. For example, populations with limited English proficiency may require interpreter services, and services may need to be tailored to meet the specific cultural needs of a different group. Very important. Okay. So the cultural dynamics and different cultural may have influence on health and social care service. For example, populations with limited English proficiency may require interpreters. So and data plays a major role in the demographics and the socioeconomic status. Socioeconomic status can influence the demand for health and social care services, as well as the ability of individuals to access and afford these services. For example, low-income populations may require more access to subsidized services, while higher income populations may require more access to specialized services, example, private hospitals and all that, while the low income may fall on the NHS. Okay. Then we have the health status. The health status of population can influence the demand for health and social care services, as well as the types of services that are needed. For example, populations with high prevalence of chronic diseases may require more access to specialized services, while populations with low prevalence of disease may require more preventive services. So in summary, demographic has a significant influence on service planning and delivery in health and social care. By understanding of these characteristics of different population groups, health and social care providers can tailor their services to meet the specific needs of their communities, ensure that resources are allocated effectively. Okay. In addition, demographic is important in understanding the characteristics and needs of different population groups and is crucial for informing policy decisions, resource allocations, service planning in a range of areas, including health and social care, education, social welfare. Okay, so let's see one, changes in population size. Changes in population size. Changes in population size can have a significant impact on the demand for services such as healthcare and education. For example, an aging population may require more long-term care services, while a growing population may require more schools and teachers. Demographic data on population size is important for predicting future demands for services and planning for appropriate resource and staffing. Changes in population size. These are very important. It can have the impact on demand for services such as healthcare and education. An aging population may require more long-term care services, while growing population may require more schools. Okay. So while the growing may require less, growing may require more, the aging will require less. Okay. So we can look into what we call the age profile. The age profile of the population is important for understanding the health and social care needs of different groups. Very important. So by knowing the age profile, you can tell the number of population growth that are geared towards the percentage of the aged and the percentage of the younger ones. That would inform you in your choice of amenities to build and all that. Okay. Demographic data on age is important for planning appropriate services and staffing levels to meet the specific needs of different age groups. Then you have the race and ethnicity. It's very important. You need to know the number of race in the population or in the community. That would inform you as to what you need to do interventions and as to help in any discrimination or anything diversity or inclusion that you need to bring on board. Then you have the regional difference and distribution of population. Demographic data on regional difference and the distribution of population can help to identify disparities in access to services and resources between different geographic regions. This information is important for planning and delivering services that are tailored to meet the specific needs of different communities. Okay. Demographic data on regional differences and the distribution of population can help identify disparities in access to those services. Then we look at trends for wider groups. Demographic data on wider groups such as socioeconomic status can help to identify disparities in health and social care outcomes related to factors such as income, education, and employment. This information is important for planning and delivery services that are targeted to meet the specific needs of different socioeconomic groups. Okay. Then we have to look at what are the common statistical terms: mean, median, mode, percentage, and race. What is mean? Mean is therefore a measure of central tendency that represents the average value in a set of data. It is calculated by adding up all the values in a set of data and dividing the number of values. Okay. Median is a measure of central tendency that represents the middle value in a set of data. It's calculated by arranging all the values in a set of data in a numerical order and identifying the middle value. Mode. The mode is a measure of central tendency that represents the most common value in a set of data. It is calculated by identifying the value that occurs most frequently in a set of data. Okay. Then percentage. We all know percentage of a range of expressing a proportion of rate as a percentage of the total. For example, if 25% of 100 people in a population have a particular condition, the percentage of people within the condition will be 25%. Race. Race are a measure of frequency or occurrences of an event in a specific population over a specific period of time. For example, the mortality rate is the number of deaths in a population over a specific period of time, typically as a rate per 1,000 or 100,000 per people. Okay. Understand these terms, these statistical terms is important for interpreting and analyzing data in health and social care research, and as well as for communicating findings to others. By using these statistical terms appropriately, researchers and practitioners can ensure that their findings are accurate and understood by others. Okay. Example in healthcare context. So we have January to May, number of patients 25, 35, 20, 45, 30, 30. Okay. Suppose you have the following data on the number of patients with a particular condition who receive treatment at the hospital over the past 6 months. You say this data, can we calculate the mean, median, and mode on policies? Of course, we can. We can. For the mean, we have to add the number divided by 6. Okay. So that's 50, 90, 45, 35, 25, you add on. Yes, so mean, you can find the answer there. The median is there. 25 and 40 divided by 2. Most occurrence is mode. There's no mode. Okay. So the most occurrence person's mode. Okay. So we can also calculate percentages every data, for example. Percentage, we calculate the percentage of patients who receive treatment each month by dividing the number of patients by the total number of patients and multiplying by 100. For example, a percentage of patients treated January 25 to 195 times 100. That's what percentage is saying. Rates, we can calculate the monthly rates of patients receiving treatment. We are dividing the number of patients by the number of days in the month and multiplying by 30, assuming a 30-day plan. Okay. So then we have the rate. We can calculate the monthly rate of patients receiving treatment by dividing the number of patients by the number of days in a month and multiplying by 30. Assume a 30-day month. For example, the monthly rate of patients receiving treatment in January 25 divided by 31 times 30. Then you get your answer. These statistical terms can help us to better understand and communicate data in healthcare context, allowing us to identify trends and patterns, measure effectiveness, and make informed decisions about resource allocation. Reading and interpretation of health and social care data statistics. Reading and interpretation of health and social care data statistics are an important skill for healthcare professionals and policymakers. 1, understanding the context. It is important to understand the context in which the statistics were collected, including the population being studies, the time period, and the methods used to collect, analyze the data. This can help to ensure that statistics interpreted correctly and in appropriate context. Recognizing limitations, looking at trends, comparing groups. Okay. And if I have to be, you have to be being aware of use and abuses. Statistics can be used to abuse to support particular agendas or interests. It is important to be aware of statistics that are being used and to critically evaluate the data and sources of information. In summary, reading and interpretation health and social care related statistics requires a regional and contextual understanding of the data, as well as an awareness of the uses and abuse of statistics. By understanding the strength and limitations of statistical data, healthcare professionals and policymakers can make informed decisions about service planning, resource allocation, and policy development. Okay. References are below. So these are your references. Make sure your references are Harvard related. And your assignments should be 12 in font size, okay? Well formatted. So today we looked at, refer to the ebooks and journals on the e-model for your unit. Further reading you can get from pages 9, 10, 6 to 64. You could also have the health information, use of information for health service planning and evaluation, or www.healthknowledge.com.uk. Okay, you have up to 2 weeks to start your assignment. If you have any issues, please do not hesitate to let us know. Okay, who is on?
Hi.
Oyibola, are you there?
Yeah.
Good. What time did you join, please?
I just joined about not quite long. I just came in because I think I've done this. I've done this topic.
From a different model, right?
Yeah, I've done this to Bodo. I just joined. Yeah.
Awesome. That's
Thank
fine.
you.
So I think you are good to go, isn't it?
Yeah.
Okay, so read your model. If there's anything,
Yeah.
if
No,
there's
that's
anything,
fine. It's fine.
let us know.
It's fine.
Okay.
All right. Thank you.
Tomorrow we'll have lesson 2. So if you have read that as well, you can join and we can quickly go through it, and any questions we can look into it. Okay.
Okay. What time is it tomorrow?
Same time, 3 p.m.
Because I've not got the link to the tomorrow.
You not. I'll share. I don't think there's a group that can share this on WhatsApp group, but you should have my number, do you?
I don't have your number.
How did you get this particular link?
I think my
Check your email.
I just got this. Yeah, I got the link yesterday.
Yes, you should have.
Because yeah.
You have tomorrow's link as well by your email.
All right then. Okay then.
But they should have a group on WhatsApp that I could share all this information. So
okay, I'll definitely say.
I don't know if there's no group, then check your emails, please. Okay.
All right, thank you.
You're welcome. Take care.
All right then.
Bye.
Bye.
Bye.